move right along. And we're going to hear from Andi Putt next. So Andi is a Texas school-based SLP. You might know her better as Mrs. SpeakEasy, because chances are you are probably one of her very many followers on Instagram or Facebook. And she specializes in autism assessment and treatment, and she's passionate about teaching parents to work on play and language at home. And Andi also posts a ton of great information for caregivers and for SLPs on her Instagram account. I seriously do not know when this woman sleeps. So she's going to be teaching us today about expanding our understanding of autism, and I will stop talking and let her do her thing.
All right. Well, hey guys. My name is Andi. It was so funny. She was asking for our intros, and I was like, I'm a speech therapist. And she was like, I'll add to that. So thank you for adding. But anyways, we can hop right into my presentation. I apologize if my face is dark. I am lit up like crazy in here, and for some reason it is still showing up as dark. But anyways, so I am in Texas. I specialize in autism assessment as a team through the educational aspect of that. So I don't do medical things. We don't typically use DSM, and so I'm not going to hit on that so much today, as more just kind of expanding our understanding of what autism is. And I talk about this on my blog all the time. So if you follow me, you're probably really familiar with a lot of the things that I say. And interestingly enough, just yesterday, I saw that there are new prevalence numbers that the CDC released. And so it was previously 1 in 59. And now this new one, it was on a research study that was completed in 2016, so still kind of old. But it's now 1 in 54. And I'm just going to throw this in. I did do the math myself for the boys and girls separation, so don't quote me on that one. Math is not my strong point. But when I did it, it was now 1 in 34 boys and then 1 in 145 girls. And I posted this on my Facebook just to kind of see what people were saying. And when I talk about this, a lot of people tend to agree with me, and then a lot of people are still on the, oh, it's overdiagnosed. And so clearly the numbers themselves are increasing, and obviously we have no idea. We can't say definitively why that is. But personally, I think that we are getting better at identifying it. I think that the stigma behind autism is getting better. People are more actively seeking intervention and diagnoses now than ever previously was happening. And so I think that a lot of it is just we know what we're looking for a little bit better. Personally, I think that these numbers are still not accurate. I think autism is more common than this. And when I throw out the numbers that I think it is, people tend to panic a little bit, because I think that autism is actually a lot more common than 1 in 54. And so don't panic on me. And if you disagree, that's totally okay, because this is absolutely just an opinion. I think that it's closer to 1 in 20, 1 in 25, which is still really only 4 or 5% of the population. But the reason why I think that is I work in education. For those of you that also work in education, I think that you can kind of see where I'm coming from with, we see at least one student, it'll even out to at least one student in each classroom that is on the spectrum. At my school, I know that there are kids that are not identified yet. And in fact, every time that I go to a new school, it's like tons of new evaluations that are happening, because I think that we are missing kids. So real fast, one of the things that I always like to talk about when I present is calling a person on the spectrum autistic person or person with autism. And I use both. I was trained, definitely, we say person with autism, it is people first. That was drilled into my head in graduate school. But when I started really listening to adults who have that diagnosis, they are really, the majority are identifying as autistic. And so I really feel strongly, if you're not following people, autistic people on social media, I would definitely recommend that, because I've learned a lot and it's changed how I view things, how I treat kids, how I assess kids, because they know. But anyways, I do like to say that because I don't want to come off as offensive, but I do use those interchangeably, and that is why. When I present to autism, a lot of times I'm presenting outside of the speech pathology realm. And so it's a lot to parents or to medical professionals. And I like to tell them, what you know, I want you to unlearn everything that you think you know, because we see those people who cling to those stereotypes, you know, so they're lining things up, or, oh, they gave you a hug, so it must not be autism. And so I don't want you guys to unlearn everything that you know, because you guys do know a lot, but I do want us to kind of broaden the ways that we think about autism, and the children who maybe are autistic, or if they're not autistic, maybe should we really look further and consider an evaluation. And so, like I said earlier, I'm not going to use the DSM. It's very confusing. I like to say autism has 3 core characteristics. The first one being language. This is where we come in. We are experts in this area. This is why I think that SLPs should be on all evaluations, because we know what typical language looks like, we know what delayed language looks like, and we know what atypical or disordered language looks like. Whereas other professionals who don't have our background, haven't been trained in this, you know, they're just not quite as familiar. Another area that we also are great at, socialization. So we know there's differences there. And then the third area is the restricted interest, the repetitive behaviors, a lot of the things that we tend to think of when we hear the word autism. I always like to throw this one out there. It's not you have a little bit of autism, and it's not you have a lot of bit of autism. A lot of people think of it as mild, moderate, and severe. A lot of the autistic adults will say that that is actually insensitive to say, you know, like the high functioning and low functioning. And so what they tend to prefer is high support and low support. And I really like that model. And so I also like to just show this as a spectrum. So it's not a line. They can have really high skills in one area, really difficult skills in one area. So you guys know all this. I'm going to get to the meat of it, I promise. So the first area that we want to look at, differences in language. So a lot of the times we see those kids that are echoing. We know that echolalia is typical up to a point, and then it's atypical. And that's not really a delay. Once we hit that year, 2.5 years and older, if we're still echoing, that's more of a sign of disorder than delay. Also labeling versus using language functionally. I think we need to be really clear when we talk to parents about this, because they think that their children are doing great with communication, but really they're just labeling the things around them. Scripting. I think sometimes we are missing when kids are scripting because it's appropriate. They can use whatever they heard outside of speech from their TV, from what their brother was saying in a game or what mom said, and then we can use it appropriately. And that's a great skill for kids that we've already identified, but I think a lot of times we really need to be looking into this a little bit better. And so an example, it was on like a Facebook SLP page, and the mom was an SLP, and she was saying she was actually looking for behavior, I guess, just help from other SLPs, and her son was saying, "Stop, unhand me," at the grocery store when she was having to carry him out because he was having tantrums. And I was like, that really sounds like scripting. Like we don't really use that kind of language. When we hear those formal language or just unusual language, we need to be really looking for that. And that's usually a common sign in autism that we don't see in a typical language delayed child or an ADHD child. We all know a reported language regression. That's something that we need to look for. And then repetitive and stereotype language. This was something that I wasn't awesome at recognizing until I really started doing autism evaluations. And so what this could look like, it could be as simple as, well, and then going on to talk about something, and then, 30 seconds later, well, and then going on to talking about something. And they can use typical intonation patterns, but that well is the same, and that's how they start a sentence very frequently. Doesn't even have to be every single time. It just has to be often. So if you hear a word, actually, literally a lot in older kids that they're using frequently, or in a way that a lot of times our kids will say, they'll say literally when it's not literally. And I'm like, okay, that's a little unusual. So they're hearing these words and they're trying to use them, but they might be using it too much. They might be making up words that aren't real words that they just like to use, or using a word or phrase or even intonation pattern in a repetitive manner. Differences in socialization. For those that are in ECI, behavior regulation. And a lot of people are like, what are you talking about? And that is when, the kid will take mom's hand to put it on the book to open things. Okay, so most of the time when we see this and it's their first attempt to communicate, that would be a definite red flag for autism. If it's a child who has tried to communicate in other ways, then that's just their going to their last resort. I'm going to put your hand on this to tell you what I want. But if that's like a go-to, that would be a definite red flag of we need to be looking. Maybe we should consider an evaluation. Eye contact. Eye contact is not all or nothing. When I look back at the kids who I had said had good eye contact, now that I really know what I'm looking for, I was just saying that they made eye contact, not that it was good eye contact. So things that we can look for when we're doing this, if the child is requesting something, are they looking at you then? Or if you show them something across the room, are they looking at you to make sure that you and them both saw the same thing? So it's more how are they using it, not is it present or is it absent? And that one takes a lot of time to really get used to. The other thing is kids on the spectrum can make good eye contact. They can use it appropriately. It's less common for it to be used appropriately all the time, but it is common for them to be able to use it appropriately at times. Facial expressions, body language, gesture use can all kind of go, communication and socialization overlap so much. But we might see the kids that have those flat affects, or maybe they're really overly exaggerated in how they're expressing their feelings, or they cling to those emotional extremes. So I know about happy and I know about mad, but do I know about frustrated? Do I know about the difference between sad and mad? And that would be a good one for those older kids. And then understanding conversational rules. I'm going to hit on that in a little bit. The last area that when I think about it in my 3 areas, is the restricted repetitive behaviors. So we all know the atypical motor movement. So we know about flapping. Everybody knows flapping is one of the things. But another thing that a lot of people do not recognize is some finger posturing. And so I'm not really sure what all y'all can see because I can't see myself. But it's when you see those really tight, I can see a couple people doing it. Some finger things. You might see it in their face. So a lot of tension in their face, and some just tension, posturing, and just kind of unusual things that we wouldn't normally see in a child who didn't have like a genetic disorder that might be causing some of those movements. Tolerance and changes in routine or environment. I know a couple of parents are on here, and so one of the things that I really want to say is I see this a lot in parent groups, and so they'll say, oh, well, my child lines things up, which yes, that's a repetitive sign. That's also a typical thing. But they don't get upset when I knock it down. That could still be autism. Okay. So when you hear that one thing, those stereotypical things, they're not always the truth. So plenty of kids on the spectrum will line things up, and then you can knock it down and they're not upset. They'll just line it back up, or they'll walk away and do something else. And then the last thing that I put also in this area is the sensory differences. And so we all know the covering your ears. We know the disliking to be touched. This also could be wanting to feel that squeeze, wanting to feel that touch, any kind of sensory reaction. So picky eating, things like that. And so one of the things that we can do when we're interviewing our parents, or if we see something that we think, oh, maybe we should look more into this, we can ask some of these questions from the parents. A lot of times parents will report things like behavior regulation. They'll talk about their child labeling things. They won't know that that's atypical, but they'll answer that question. Yes, they are doing that. Yes, they are a picky eater. Yes, they become upset when they perceive something to be unfair. Or yes, when they're seeking that sensory input or avoiding sensory input, that really impacts their language. And so a child who sometimes is very verbal, very easy communicator can lose those skills and almost be like they can't communicate because they are so dysregulated or overwhelmed. Really the meat of what I want to talk about today is who are we missing? And so the ones that we're missing are the kids that are socially motivated. So they want social interactions, they want social contact, but they're not quite sure how they need to go about doing that in the most appropriate way. And a lot of times that's girls. And so I really go back and forth on if I think autism is prevalent in girls as it is in boys. I think it might still be more common in boys than girls, but I think girls are hugely underrepresented. If you go on to any of those autistic adult Facebook groups or follow any on Instagram, a lot of them weren't diagnosed until they were adults, and plenty of people aren't diagnosed until their kids get a diagnosis, and they're like, well, that's not different because I do that. And I'm like, I don't test adults, but it's genetic. And so I think that it is way more common in girls than what we're seeing. I think it's more common in verbal boys. And then definitely complex cases or multiple disabilities. And so a lot of times if I'm getting a kid who I'm going to assess and they have a medical diagnosis of ADHD and language delay and SPD, generalized anxiety disorder, I'm going to go, I feel pretty certain that this, instead of those 4 different things, this is better going to be explained by autism. But people don't think of autism when we have those verbal or those social kids. A big thing that I think a lot, and this includes SLPs even, a lot of people struggle to understand is the difference in social motivation and appropriate socialization. And so when we see kids that are socially motivated, they want to interact with others. They are interacting with others. They have friends. A lot of the times we'll just be like autism won't even cross our mind because they're talking, they're answering questions, they're interacting, they can take turns, they can play because they have that social motivation. But a lot of times when you look deeper, it's not always appropriate. And so some of the things that we see, especially in girls, are those girls that are overly social. And this can really, when you're overly social, it really can be dangerous, especially when you get older. And I'll talk about this a little bit more, but kids with disabilities are targets for sexual abuse, really emotional abuse, physical abuse, any kind of abuse. And if you are overly social and you are really seeking that attention and you don't know how to do it appropriately, that's going to make you a bigger target. Especially you're not recognizing your boundaries, and you might not be recognizing your boundaries that you should have towards other people. And so that's why I say that that's dangerous. That's why we need to be identifying those kids, especially because a lot of times their parents are like, oh, well, it can't be autism. Are you crazy? They hug everybody or they talk to everybody. You should see them at the grocery store. And I'm like, that's not okay. You know, we can't do that. That's still not typical. It's not avoidance of other people, but it's still not typical. And then the other one that we miss a lot is reciprocity. And so social reciprocity. This one took me a really long time when I started doing autism evals to get really good at actually recognizing. And I think it's because a lot of times we think that we're having reciprocal interactions because we're talking and it's going back and forth. And then when we really, really look into the specifics of it, it's not really reciprocal. So what it means is the back and forth flow of interactions. And it is really dependent on your ability to change your behavior based off what the other person does or says. And so as SLPs, a lot of times we work on or we talk about recognizing when other people aren't interested, right? So we do those really obvious ones that people don't even really do, you know, like, you know, we don't actually do that in conversation, but we teach our kids about that, which I just think is funny. I teach my kids that and I'm like, well, it's going to look more like this, you know, where the person's looking around to show you that they're not interested, or they're going to turn their body away from you or inch away. But so we need to see what that person is doing and then change our behavior. That takes a lot of attention. So we're going to see kids with ADHD really struggle with this as well, because attention is a huge part of this. But really understanding social cues and understanding social rules, those unspoken social rules that nobody ever explained to them, and that most people aren't going to explain to them because it's rude to explain them to people. And so I often say that this can look like if somebody has deficits in social reciprocity, it could look like the kid or the person who really dominates those conversations. So I am going to talk about Minecraft, and if it doesn't matter if you look away from me, or it doesn't matter if you change the topic, I will find a way to bring it back to Minecraft. You know, so that's like when you're like, oh, well, I went to the store yesterday and I found this really cool new toy. And they're like, oh, I built a store on Minecraft, you know, and so they think it's on topic because you said store and they said store, but we're not really. I don't care what toy you got at at the store, or not even, I don't care, just that's not what we're talking about. We're still on Minecraft, you know, so this is what we are talking about. This is the Minecraft conversation, you know, and so we're just going to keep going. And I compare that to teaching a lesson. So right now I am dominating the conversation because I am the one teaching. And so when I talk to my kids about that, we'll say, right now, am I dominating the conversation or am I teaching? You know, and so they're identifying the difference in that. And then when they're talking, I said, you're not teaching us. This is speech. We are having a conversation. So it's me dominating, me teaching. And then when it's time for us to talk, we are all participating. Another one that we might see, and this happens a lot in younger and older kids, relying on the other person to ask questions and carrying the main weight of the conversation. And so a lot of times parents think that they are having a conversation, but it's, what did you do today? I had PE. What did you do in PE today? We played Ghostbusters. Who did you play with? I played with so-and-so and so-and-so, you know, so it's going back and forth. They're answering your questions. It's on topic, but it is so dependent on the person asking the questions. And then if the person says, oh, well, I had a really interesting thing happen today at work. And then the kid might be like, okay. You know, and so they really struggle following those leads. Or they might know, oh, I know I need to ask about that. That was a clear lead. But then later, if I said, oh, well, my favorite one that I always use this as my example is, I have a cat. Because that's not a clear lead. Not at all. It's just a comment, a very short comment, and kids don't know what to do with that. And so I might ask them first, you know, do you have any pets? And then they'll say, I have a dog. And I'll say, well, what's your dog's name? It's so and so. Well, what kind of dog is it? It's blah, blah, blah. And I was like, oh, okay. Well, I have a cat. And even though I just modeled all of those questions that you could ask to get information from the other person, they just don't know what to do. So really, when we're looking at these, we need to look at how our leads are given. And so our easy leads, I did the coolest thing yesterday. You know, so a lot of kids, it could be interesting to them, first of all, but also that was a very clear lead versus my son went to pre-K, you know, or something like that. Let's see. Woo! Okay. Autism and girls, my favorites. I could talk about this all day, and I will try really hard not to. But we know we are missing girls. And they are, you know, we've seen the ASHA article, they're hiding in plain sight. And we know that they look different than boys. We know we're missing them. And yet it is still, there's not, somebody asked me today if I had a good resource on it. And I was like, I haven't seen a good resource on autism in girls. And honestly, I feel like to have a comprehensive one, I would need to be talking about this all day. Like this is a all day thing to be able to cover all of the things with girls. And so I'm just going to try and give you guys my main tips. And then if you follow me, Miss SpeakEasy on Instagram, I have a story highlight, which is not nowhere near finished. It's not my whole day talk about girls, but I do talk a lot about them. And that would, if you're interested in this, that would be a good thing to go and watch if you wanted to learn a little bit more. And then definitely, if you have any questions, you can ask and I will be happy to answer them. So why are we missing them? They are socially motivated. We've already talked about this one. Girls are very socially motivated. They appear to be engaged when we look at them, when we watch them play, when we watch them interact. They are always with a group of girls. They are excellent imitators, and they are masking. And I know most of you are speech therapists, but I'm going to go ahead and say what masking is just in case. And so masking is basically you are imitating what you see. And so they will watch those popular girls, the girls that have the friends, the girls that are getting a lot of positive social attention, and they are going to study their every single little move. And this is exhausting, okay? They're going to study their every single little move, and then they are going to try to replicate that. But they have these deficits in understanding social rules. And so when they try to replicate it, it comes off as weird or unusual to the other girls because they know what other girls their age typically do. Okay. And a lot of times parents will talk about these girls because like, you know, when the soda analogy for ADHD, that's so relevant for autism and especially autism in girls. And so your girl is a soda can and she goes to school and something happens. So shake it up. And she's okay. She's got it under control. She can keep it together. And then her friend says, I don't want to be friends with you. Oh, shake it up some more. Okay, and then we normally go to PE, but there was something, a program that was today, and the teacher forgot to tell me. We should just throw that on the floor. I mean, drop that soda bottle, okay? And then when it gets home, something happens and it explodes, and the soda is everywhere, and it's just a mess. And so, sorry, something is popping up on my screen. And so parents see this a lot with their girls, and you hear this complaint a lot, and they look totally fine at school all day, and then just, I don't want to say what I'm thinking, but the you know what hits the fan, and it is a different child at home than at school. And so the things that we want to look for with these girls, they are the exact same characteristics, okay? So these girls, a lot of the times, they are in speech. They are in speech because they have language delays. They have sensory accommodations in school. We see their sensory differences, but they are socially motivated. So we don't see those the social deficits as clearly as we would if it was a boy. They are always with their friends. They are talking about their friends. They can tell you about all the girl fights that are going on at school, and they know all the details. And so it just doesn't even cross people's mind that it could be autism, but those differences are there. And one of the things that I like to tell people to look for is that high pitched, I call it the Minnie Mouse voice. So we see this in the younger girls, especially, but a lot of girls will carry this on to elementary and even middle school sometimes. And so they talk really high, and it's super cute, but atypical. Okay, so that a lot of times that is my first clue. I'm like, I need to look deeper because that is atypical. Again, the parents will very openly report sensory differences. They're going to be picky eaters. Well, they're not going to be, but very likely they will be picky eaters. They will be sensitive to loud sounds. They will seek input or avoid input. We see that a lot. They often do have some creative play, and this is another topic that I could talk about for days, what play would look like. And so kids with autism, they can do creative play. It's a lot of the times it's delayed. So where we might see a typical 18-month-old child building something and feeding their bear, AU kids are doing that like at 3, where typical 3-year-olds are creating a whole scene of play that's all creative with nothing concrete. The autistic kids are usually delayed in that. But girls, so they'll pretend to feed their baby doll and they will change the diaper. But a lot of times what you'll notice is it'll be repetitive. So you might go and observe them play with their friends or in solitary play, and you might be like, wow, that looks so good. And then come back a day later and be like, and they'll do the same thing, the same play scene, the same play series. So we need to be sure, especially with girls, that we're not just observing their play like on one opportunity. We need to be watching different plays, and then also see if you can insert yourself into that play and change it a little bit and see how she responds to that. Does she keep going back to the same thing? We also see the older girls, they'll follow the girls around. They think that they're part of the group and they think that they have best friends with that group. But then when you ask the other girls in the group, she's just kind of there. She's nobody's best friend. She's kind of in the group, but also kind of on the outside of the group. Or she has a mother hen, and so she is so reliant on that hen to keep her involved in anything, because we do have nice girls. We always talk about the mean girls, but we do have nice girls, and especially in elementary school, who will kind of mother hen them around and be sure that they're involved and take care of them, and help them out really with everything. So that could be schoolwork, that could be social, their friends, a lot of things. And the other thing, they can be more responsive than initiative in conversations. And so again, you'll see those answering questions but not following leads. You might also see fewer leads given by them. And so I talk about wait time a lot, and I would encourage you to use that in your evaluation. And so you are going to give a lead. So I have a cat. And then you're going to stare and you're going to be really weird and uncomfortable about it. And you're going to do it on purpose. Okay. And so I did this with a girl last week, and we were this far apart. I don't know if you can see this far apart. So like 8 inches apart. And I stared at her after giving her a lead. and she stared at me. I counted to 14 seconds. And I know that doesn't sound like a lot, but I try it with whoever you are stuck at home with and stare at them for 14 seconds. It is weird. It is super uncomfortable. And she just stared me down like she didn't even know that it was uncomfortable. And so most typical kids will be like, this is weird. I need to say something. I need to give you something so that we can continue to talk. And these girls aren't really recognizing a lot of that. Again, you might see a flat or an exaggerated affect. So like really flat, and I'm going to talk and it's going to be really, really monotone. Or I might be really expressive about how I talk, and I could talk like a valley girl even, and it could be really just so excited or exaggerated when there's nothing exciting or no reason to be exaggerated. And then the last thing that I wanted to touch on is, why do we need to identify them? So I've already said that they are at risk to be abused for sure. They also are at high risk for self-harm behaviors, because if you don't know, these girls, they know they're different, but they don't know why. So it's a lot of, why does so-and-so have friends and she is so popular, and then I try so hard. I do everything that she does, and I mean, like, they exhaust themselves trying to be like those girls, and then they don't have friends, or they kind of have friends, but they upset them all the time, or they have lots of struggles socially and they don't understand why. That puts them at risk for depression. That puts them at higher risk for anxiety. That puts them at higher risk for self-harm. And then one more thing that I want to say, and then I'll take some questions. I really should have started a timer. But I think that, oh, you know what? I don't know what I was going to say. I lost my train of thought. I'll come back to it if I can. But we can go to questions, and then if it does come back to me, I will definitely interrupt with that.
So if you have a question for Andi, you can raise your hand with that raise hand button, or you can type it into the chat, and Ken's going to moderate the questions.
Perfect. One person did send a question in to me. This is from Judy. What do you think about the social language disorder diagnosis versus autism? A lot of what you're describing can be SLD. I feel that these kids are the kids that used to be called Asperger's.
Yeah, so I would have to say that I have never seen a case of social language disorder. I think most of the time those kids would fall under the autism umbrella, or it would be like ADHD with those social differences that are kind of looking like a social language disorder, but it's not that they don't understand the reasons behind things. It's just they're not attending. And so they can't apply it to real life time, because we know, like, if I sit you down and give you examples of things, kids, even kids with autism, can a lot of times tell you exactly what's going on in these scenarios, but then real life comes and it just, all of their strategies fly out the window. So we see that with autism and ADHD. I do feel like it's probably one or the other. And I honestly, I haven't seen a child who I would say, yes, that's social language disorder and there's nothing else. I think it's the repetitive behaviors are harder for people to identify.
We have another question from Lauren. She's asking, how do you bring this up to parents, especially if a girl has high language skills?
Yeah, so usually I will build on the strengths first. So she is doing so great in speech, she's making progress, but I still do have some areas that I have concerns in. And so that could be, usually I would just list them out, or I'll give examples, or I'll give the parent an opportunity to tell me what they see. So how do they do at home? Do they get along with siblings? Do friends come over? Do they ask to see their friends? And sometimes the parent can kind of lead you right into the things that you're seeing to prompt that evaluation. And then I see Carrie. Hi, Carrie. Yeah, and so social language disorder, it wouldn't have the sensory differences. I think a lot of kids have some sensory differences, and so that one is a really hard thing to include in any kind of exclusionary diagnostic criteria. But yeah, so she says there's no language delays. That could be autism with no language delays as well. So we know kids on the spectrum they could not have language delays, or maybe they initially had some and then they caught up real quick.
Great. We have a question actually from our previous speaker, Laura Brown. Do you want to jump in, Laura?
Sure. Okay, Andi, my question for you is, where do you kind of draw the line? So you see like some of these like borderline kids that are really high functioning, and they might have like a few of the things you talked about within like the social differences and just some little quirks. So where do you draw the line? Are you looking at how it's impacting their functional skills, or is your kind of blanket response just if you're seeing these signs, they need to kind of go in the direction of an evaluation?
So I always recommend an evaluation, and the reason is because those kids are at risk. And when you follow the autistic adults, they are so clear about how much they understand themselves once they know that they have that diagnosis. And so I would always say an evaluation is not going to hurt anybody. Sometimes I will, because like I said, when I go to a new school, I will have probably 10 or 15 kids that are on my caseload that I'm like, we need to look a little bit deeper. And so I think it's okay to kind of space those out a little bit as time goes. But I think that if there are concerns, it's probably good to look at it just so that they can have that knowledge.
Okay, thank you.
Here's a question. I'm going down them in the order I have received them. This one is from Birgitta. Sorry about the pronunciation. Related to the school setting in junior high, do you ever identify a child with autism and not recommend therapy due to his or her ability to function well in the school and community setting?
So that would definitely be a case-by-case basis. If the child has never had any speech therapy, I would be more likely to recommend a little bit of direct service time. But a lot of times I'll put those kids on consultation services that seem to be doing really well. And usually I would, in the school setting, I always would say, if you have a 5th grader who you think is ready for dismissal, I would move them to consult just in case, because that's a huge jump, a big change. We don't know what's going to happen. Middle school is hard for neurotypical kids to navigate, and it is super hard for neurodivergent kids to navigate.
Here's a question from Kelly. Do you see anything different between girls and boys at 2 to 3 years old that would help us identify them earlier?
Sure. So the girls, again, that Minnie Mouse voice is often you see that at those younger girls, and then watch their play. Their play can be pretty repetitive. I feel like those are the two big differences. Usually girls have really typical restricted interest, and so it could be Minnie Mouse, Frozen, or lipstick, lip gloss, things that are really typical for kids to like, but then I want to see how they're using it when they talk about it. So are they setting their things up for play but then not playing, or are they really engaging with their preferred interests?
Thanks. Catherine asks, if you could just give your social media link again for people to follow you.
So I'm mrsspeechiep, and I'll type it in the comments. I am almost at 50,000 on Facebook, so go follow me. I'm really excited to hit that. That's where I have my most followers, but I probably share the most information on Instagram. So I will type that in here as soon as I'm finished.
Melanie asks, comments very interesting, and asks, I know this will be dependent on the child's goals and needs, but how will intervention be different for girls with ASD versus kids who present with difficulties more congruent with our stereotypical view of autism?
So, yeah, like you said, it would just be dependent on the needs. If I have a girl who is pretty much a low support girl, I might focus more on the language if that's the need that I see. But then we'll always hit some of those talking about emotions and reading other people's behavior. We kind of hit those a little bit earlier than I would have without having an ASD eligibility or diagnosis.
Okay, and we have, let's do 2 more questions and then we will continue on. First from Jenna, how would you identify the difference between autism and ADHD with a toddler preschooler with an articulation disorder?
So I would really look for those, is there any atypical language? So that's a big difference for autism and ADHD. And then again, the repetitive or restricted interest, is there a toy that they really like? Are they having routines that they're insisting upon? And then the other thing, I feel like lately I have seen a lot of kids that are speech only for articulation that I have been like, oh, we really need to look more. And I haven't seen that research link yet, but I wouldn't be surprised if that comes out. But yeah, I would look at for any atypical language and then for the repetitive restricted interest.
And we'll close with a question from Donna. I have noticed a lot of girls in the 2 to 3-year-old range who I suspect being on the spectrum also having a lot more atypical jargon. Have you also observed this?
Yes, definitely. So we see boys a lot with the jargon, but the girls, I see them kind of hold on to that. They tend to do more jargon than echolalia even, where they're just talking and then they keep the same typical intonation patterns because they're great maskers, but they're just jargoning along and it's like they're having their own little conversation, but we don't know what's going on.
Great. I think we will stop the questions there. Thank you everyone for asking your questions. And thank you so much for presenting to us, Andi.
You're welcome.
All right, thanks, Andi.